Can you see?
Yes.
Yeah, now we can see.
Okay.
Thank you.
So I'll be presenting our study on the integrating renal and hematological markers to track disease progression in women with chronic kidney disease. First, I'll introduce the background of this study. The chronic kidney disease is a progressive disorder that is frequently followed by hematological disorders such as anemia that accelerate the disease progression and impair the quality of disease. Women are disproportionately affected due to the biological, hormonal, and social cultural factors that increase the vulnerable to anemia and their related complication. So there is a need for gender focused evaluation and monitoring in the CKD patient. As we all know, serum creatinine and urinary protein to creatine ratio, estimated glomerular filtration rate are well recognized renal markers. Their combination alongside the hematological parameters such as the full blood count and RBC morphology that may offer an in-hand assessment of disease progression in women. So understanding the link in between the blood parameters and disease progression, so that enhance the assessment of the disease progression in women. Our objective was to evaluate the integration of the serum creatinine, UPCR, and hematological indices as markers for monitoring disease progression in women with CKD. The methodologies that was followed in our study, we conducted a descriptive cross-sectional study on the patient who had been diagnosed with the chronic kidney disease based on the recommended diagnostic criteria, attending the nephrology and medical clinic at Teaching Hospital, Jaffna. Total 137 CKD patients were included in this study using convenient sampling technique according to the availability and willingness of the participants. After the informed consent, we record the data on clinical registration number, age, gender, full blood count, and UPCR report value were recorded in the data extraction sheet. The blood sample from patient were collected into the plain tube for serum separation and EDTA anticoagulated tube as a whole blood. Parameters that was measured from the blood sample, the blood hemoglobin concentration using cymethemoglobin method, serum creatinine concentration using Jeffrey's method, further red blood cell morphology that was observed in the peripheral blood smear. Finally, the obtained data were analyzed using SPSS software version 26. The patients were categorized into different CKD stages based on the estimated glomerular filtration rate. Additionally, anemia and their severity were classified according to the WHO criteria. Let me share some key findings from our study. In the total CKD population, 56.2% of them were women. Among them, as you can see in this graph, the highest percentage were categorized under CKD stage 2 with 39%. The lowest percentage were categorized under CKD stage 4 with 9%. The 42.9% of women with CKD had anemia, and its severity was significantly associated with progressive CKD stages. Normocytic normochromic anemia is a common type of anemia observed in the women with CKD. 75.3% of the women with CKD had normocytic normochromic anemia. Hematological parameters such as hemoglobin, hematocrit, and RBC count decline progressively with advancing CKD stage with statistical significance, while serum creatinine and UPCR value exhibit a stepwise increase across different CKD stages, but there is no statistical significance along with the different CKD stages. As you can see in this graph illustrates the mean of different hematological parameters such as hemoglobin, RBC count, hematocrit, MCV, MCH, and MCHV. Here, hemoglobin, hematocrit, and RBC count that decline through with the advancing CKD stage. At the same time, MCV, MCH, MCHV were similar throughout the different CKD stage. When we examine the mean of different renal parameters such as serum creatinine and UPCR along with the different CKD stage, as you can see, serum creatinine and UPCR exhibit a stepwise increase throughout the different CKD stages, but there is no statistical significance along with the different CKD stages. Hemoglobin levels showed a moderate negative correlation with serum creatinine. Similarly, hematocrit and RBC count were negatively correlated with serum creatinine with the respective R and P values. Let me discuss about the key finding from this analysis. The high prevalence of anemia in women with CKD. Notably, 42.6% of women in this study had anemia, that highlighting the significant burden of hematological complication in this population. The women with CKD are particularly vulnerable to anemia due to the several factors, such as the low baseline of hemoglobin when we compare to the men, menstrual blood loss in men, premenopausal women, and differences in the iron metabolism and hormonal variation that influence the progression of renal condition and respond to the erythropoietin deficiency. Nomocytic nomochromic anemia, 75.3% of the women with CKD had nomocytic nomochromic anemia. So which aligns with previous finding that is a common complication of CKD due to the reduced erythropoietin production. So when we examine the renal and hematological parameters that reflect the pathophysiology of the CKD. So when advancing CKD stages with declining hemoglobin, hematocrit, and RBC count, at the same time increasing serum creatinine and UPCR. That reflect the pathophysiology of the CKD, where impaired erythropoietin production and loss of the renal function that contribute these changes in the hematological and renal parameters. When we examine the anemia severity that increases with CKD progression, so that indicate the worsened renal function that is closely linked with the declining erythropoietin. So this highlight the interdependence of renal and hematological parameters in disease progression. But the anemia severity is not significantly associated with the levels of UPCR or degrees of proteinuria in the selected population. This may reflect that other than the beyond the UPCR value, the different factors that influence the anemia severity in the selected CKD patient. To conclude, the integration of the renal and hematological parameters that provide more comprehensive pictures of disease progression than using renal markers alone. So the gender-based, the target-focused monitoring and management of the CKD patient, that is very useful and improve the outcomes and reduce the severe complication. Thank you for your attention.
Okay. Thank you, Dr. Karthiga. Can you go to your methodology slide?
Wait a second, madam. Methodology. Okay, madam.
Did you take
Madam?
an ethical clearance or anything?
Yes, I took it, madam. I took it from the Ethical Review Committee, Faculty of Medicine, University of Jaffna.
Okay, nice. And very important study. Yeah, you have any idea about in northern side of Sri Lanka and Kurunegala district and Jaffna, many people with CKD. Is any special observation?
Special observation. Oh, no, madam. So, because my studies on anemia in the CKD population. So, I took the CKD population and I did the analysis on the anemia on the CKD population.
Yes, 75% of CKD normocytic, normochromic anemia and 42% high prevalence of anemia. No?
Anemia,
CKD.
madam. High prevalence of anemia.
Okay, Dr. Kishani, anything to add?
Yes, madam. Doctor, why you are selecting, as I see, you collect both male and female in your sample. There were both, no?
Yes, male and female.
Yeah. So why you special attention given for women?
Women, because of
Yeah.
women are, so the here the CK women are more vulnerable to the anemia. So because of their not only their lower baseline of the hemoglobin and their nutritional state that is different from the men. And another thing, uh,
Any menstrual
yes,
problem?
that the blood loose during the menstrual period, and there is a different pathologically they are different in between men and women.
Okay, as I think it's better if you do this as a comparative study, no?
Yes.
Male and female,
Yes,
if you compare the results, it's I think it's better.
it's better, ma'am.
Well.
Yes, madam. Yes.
Okay, thank you.